My name is Danny Manning, and I'm the manager of the Cardiac Rehab Program at McKenzie-Willamette Medical Center. I also oversee the echo department, EKG, and EEG. So for cardiac rehab, that's where I started my career in direct patient care as an exercise physiologist. Currently, my role is to do some direct patient care, but also oversee the operations, make sure things are running efficiently, patients are getting the optimal care that they need, looking at our outcomes and trying to improve on those going forward. So people that work in cardiac rehab, there can be a multitude of people that work in cardiac rehab. Here in our facility, we have all exercise physiologists that work with patients in cardiac rehab. On a daily basis, we do what's called phase 1 and phase 2 cardiac rehab. So phase 1 cardiac rehab is a program where patients that have had recent heart attacks or recent heart procedures are referred to us. So every day we come in and we see what new patients are referred. We look at their diagnosis to make sure it qualifies for entry into cardiac rehab. We then go see them in the hospital and educate them on what to expect after their hospital discharge, and we get them scheduled for their outpatient phase 2 cardiac rehab visit. Then for the rest of the day, we have phase 2 cardiac rehab patients coming in throughout the day. Every 30 minutes, we have new patients coming in, and it's kind of a rotating schedule. Each patient that comes in is with us for about 60 minutes. We review how they've been doing since their last time here in cardiac rehab, making sure they don't have any new symptoms or complications. If everything is stable with the patient, we'll review their exercise plan, and then they will be completing both aerobic exercise, strength training, and stretching exercises until they're discharged. If there's any abnormalities that we find, both with symptoms or anything that we see with their heart rate or heart rhythm or blood pressure, if they're concerning, we're communicating that with the cardiology group so that they can be attended to and that their risk factors can be controlled. So exercise physiologists, we have both bachelor's and master's trained exercise physiologists. Most people will enter an undergrad program in either kinesiology, sports science, exercise science, or exercise physiology, and then can progress to a master's level with similar programs. Most are in either exercise physiology or exercise science. Now, there's only a few programs in the country that specialize their grad programs to cardiac rehab, but there's a lot of programs that provide internships in cardiac rehab, and that's really the main way to get on-the-job experience prior to getting hired in a full-time position. Trying to contact local hospitals and see if they have cardiac rehab and see if there's shadow experience. I think that's highly valuable, just to get a hands-on approach and see what patient care looks like. If that seems interesting, then enrolling in a school that has an exercise science or an exercise physiology program. There's many different routes you can go in exercise science or exercise physiology. Cardiac rehab is just one of those. So getting enrolled in a 4-year program to earn that degree would be what I would suggest. And then during that time, looking into cardiac rehab, maybe internships or other shadow experience, but also exploring other options that you could do in exercise physiology. A lot of people in an undergrad exercise science program will progress to things like physical therapy and those types of things. Try to expose yourself with many different areas that you're interested in. Things that you might think you want to do for your career out of high school may not be what you end up doing, so exposing yourself to different areas and seeing what's out there, trying those things out by either doing internships or shadow experience and seeing what really clicks. I think you have to be passionate about what you do, so trying to find those areas that really become rewarding is something that can make you successful long term. If there's an opportunity to volunteer, do it. If there's an opportunity to work more hours or do something more than is expected in your current job title, do it, because all of that will pay off in the long run. You'll learn from those experiences. You have to get out of your comfort zone to grow, and that's what I would suggest. So, yeah.